Hello and welcome to Health Live at Seniors Today. We are delighted to have here with us Dr. Mazda Turel. Dr. Mazda Turel is a spine surgeon is a neurosurgeon at the Wockhardt hospitals and at the Sir H.N. Reliance Foundation Hospital and Research Center. A winner of several awards and accolades, Dr. Turel has done a fellowship in cerebrovascular surgery at the Huashan Hospital, which is in Shanghai in China. He has a fellowship in complex and minimally invasive spine surgery at the Rush University Medical Center in Chicago at the US, and a fellowship in Neuro-oncology, endoscopic and open skull-based surgery at the Toronto Western Hospital in Canada. He's also a consultant neurosurgeon and assistant professor at the Department of Neurological Sciences, Christian Medical College, Vellore. Dr. Turel, we have requested him to speak to us about back care for senior citizens. Welcome to Health Live, Dr. Turel.
Hi, good evening, and thank you very much for having me here. It's a great pleasure to be on your event.
Thank you very much. Always good to have. And I was speaking with Dr. Turel a little while back and trying to understand. He's a spine. The talk today is about back care, etc. And he is a neurosurgeon. So I was trying to figure, and he mentioned that it's spine surgery, etc. is actually a function of a neurosurgeon, and orthopedics also do it. And of course, as we go along, we will also speak with you, and perhaps you could. There's a question which has come in on that, and which is why I thought I would ask you, Dr. Turel. One of the things that I normally ask, and unfortunately, is a question that I still need to ask, is with this new strain of the virus coming in. Do you see signs of despair already, or is it too early, at least in Mumbai and in India?
I mean, it's anyone's guess. Nobody really knows much about these things. Everybody is just able to predict this stuff in hindsight. But I mean, if you follow the trend, then we've always followed Europe by about a couple of months. And if we give it January, February, we might see the reality come to us. So the advice would be not to get scared or panicky, but don't lower your guard. I mean, wear a mask, do whatever it takes, get vaccinated, and all of those things.
One of the things I've been stepping out a bit already, and at major public functions and at restaurants, etc., that you have in a city like Mumbai, while people enter in with their masks on, but soon enough they're off. And how do you do it, for instance? I'm sure you also do step out to.
You don't have a choice, right? You have to eat, so your mask will come down. I mean, there's you prefer to go to places that are open air rather than enclosed in an air condition. That's all that you can really do. But I mean, it's very difficult to really say what is the right thing. For how long are you going to stay away from all of this? If you're adequately vaccinated and you're taking basic precautions, I think you should be fine.
The worry is, Dr. Mazda, that we are in a situation where nobody really knows, and top medical professionals like yourself, who are attached to hospitals, and you obviously are in tune with the reality and with what is happening else across the world. If you are saying that, then us lesser mortals will just don't really know what to do.
No, but I mean, that's the fact of the matter, right? Everybody's just learned this whole thing along the way. Nobody's really understood this game very clearly. Everything that we thought was correct, a lot of it has been proven inappropriate. So we just have to, I think masking as far as possible is the most basic guideline that has been, that has stood the test of time, and vaccination.
Great. As we keep our guards up, let's get to the topic today, Dr. Mazda, about the spine and about back care for senior citizens. Over to you with a presentation. Those of you who have questions, please put them in the Q&A tab. We've received some of questions already on the mail. Please put them in the Q&A tab. And as always, I request you to put your age and gender so that Dr. Mazda is able to give you a more informed response. Over to you, Doctor.
Hi, yeah, so I'm going to talk about really how do you take good care of your back and what entails, what are the spine problems people encounter and how do you really sort them out. And to answer your first question, it's not true that a neurosurgeon only operates on spine cases. It is this combination of you can either go, if you have a spine problem, the commonest question to ask is who do you go to? So you can either go to a neurosurgeon or you can go to an orthopedic surgeon who is trained in spine, who does spine surgery on a regular basis. So both of them are adequately trained, depending on the kind of volume that they see and the cases that they do and what their comfort level in doing those cases is. So it could be either one of the two. That doesn't make a difference. So to understand the spine, you see it's an extension of the head, and it's a while there are 35 vertebrae stacked one on top of one another, they have their own individual curvatures, and you have a cervical spine, you have a thoracic spine, you have a lumbar spine, and then you have the sacrum, which is where you rest your butt on. And between these each vertebrae, you have a disc, intervertebral disc, which acts as a shock absorber. And at each level of the vertebrae, nerves leave and either supply the hand or the leg, depending on what level they get out from. And this is a spinal segment where you see one vertebrae and a disc in between and another vertebrae. And this whole is from where the nerve leaves and supplies the leg. And in case this disc bulges is when you have what we call as sciatica or leg pain or radicular pain. So what I really want to focus on is not disease or what do you do when you have a problem, but rather than preventing these problems. So in preventing these problems, you have to adopt a very, very healthy posture. And the key in sitting, whenever you sit, you have to understand that all spine problems, they arise from weak muscles. They don't come from bones that are bad. They don't come from joints or ligaments that are bad. I mean, partly those may be contributing, but the main contributing factor is inherently weak muscles. And to be able to prevent any kind of spine issue, you should strengthen those muscles. So when you sit in a chair, you have to sit, with your bum shoved in the right angle of the chair and avoid any kind of slouching. That's really the key. Don't slouch into a chair, and don't sit in any one position for more than half an hour. Every half an hour, try get up, just take a little bit of a walk, maybe 30 seconds, 45 seconds, that's more than enough. Come back and sit. So that is extremely key. When a lot of us are working from home, and even the elderly are now very familiar with the computer and laptop and are spending a lot of time, you should make sure you're sitting in an ergonomically designed chair with some kind of a lumbar support. Your shoulders are well relaxed, your elbows are resting on an armrest rather than just drooping down. Your computer screen is at eye level and roughly at a distance of about 2 feet from where you're sitting, and you have some kind of a footrest that's allowing you to adequately relax your thighs and your calves. So these are small things that you should pay attention to, and that really balances out the spine rather than stressing it. If you're trying to get on wearing shoes before you go for a morning or evening walk, you make sure you put the leg on the opposite knee and then wear that shoe. And similarly, when you're lifting down to bend something, when you're bending down to lift something, you bend at the hip and the knee, and don't just bend straight with your back forward, because that really increases the load on the spine. So when you lie down, a lot of people have very different techniques of lying down, but if you lie down flat on the bed, then ideally you should put a pillow below your knees, so that the knees flex a little bit, and that reduces the tension on the lumbar spine. And similarly, if you're lying on the side, which is ideally the correct posture to lie in, you put something, a pillow between your knees like this, and that balances out the spine very nicely. And that again reduces the wear and tear on the spine. When you get out of bed, it's extremely important that you use your hands uh, and put your leg down first, and then use your hands to get out of bed rather than just using the pressure on the spine. Similarly, when you're getting into a car, don't get into a car with one leg at a time. You first sit on a seat and then bring both your feet together, put it inside, and then close the door. Similarly, when you're getting out, use both your feet, put them out first, and then stand. Doing one foot at a time or one leg at a time increases the wear and tear on the spine as well as on the hip and the knee. So don't, and if you're trying to lift something, if you're bending down to lift something, don't lift anything away from the body. Please bring it very close to the body and lift it. If you're able to follow these basic techniques of sitting, standing, sleeping, walking, and driving in a car, then there's a very high chance that you're going to prevent a significant amount of micro injuries that take place to the muscle. A lot of people, when they get up from a sitting position, they have a lot of pain, and that's because their muscles are not toned well enough. They're not stretched well enough. They're not exercised well enough. So if there's one message, if I were to give you just one message, if you were to take home one message from this whole talk, especially for the elderly, I would suggest that you keep as mobile as possible. There's no indication of bed rest for any kind of spine problem. I mean, or let's just say there's very, very few indications to be on bed rest if you have back pain or leg pain. So the general recommendation would be to get up every half an hour and walk, be constantly mobile, use the stairs as and when you can, walk for short distances to the grocery or to the bank instead of using the car. If you can bicycle, then that's great. If you can swim, then that's great. So when a lot of us have low back pain, when it's degenerative back pain, especially in the elderly, this kind of pain is, when you load the back, when you are standing or sitting, those are actions that load the back. And all these pains, 90% of these get better with medication, physiotherapy, some kind of shortwave diathermy, etc. You can see sometimes, however, if patients who have chronic back pain, you should do x-rays of the spine and movement to be able to pick up a subtle instability, because while most of these pains can settle down with physiotherapy, you don't want to suffer unnecessarily when there is a minimally invasive surgical option to be followed. Like, for example, this lady had such a bad degeneration of the spine. You can see that her discs are protruding and pinching on the nerves, and we did a minimally invasive surgery and fixed her and with a remarkable recovery. And this is another lady who had multiple spine operations, but the main problem of subtle instability was not addressed. Also understand that not all low back pain comes from the lumbar spine or comes from the spine. It can come from the sacroiliac joint where the spine meets the hip. So there are special tests that need to be done to be able to identify that subset of patients. And a clinical examination is very important by a physician, a surgeon, a neurologist, whoever you're going to be able to determine where is the pain coming from. So if you have pain that's not getting better over a couple of weeks, don't try to treat it yourself. Visit a physician and get a good idea of what kind of pain this could be and how to best address it. That is key in being able to manage spine health. What I do regularly is, give my patients a chart of back exercises, which I'm happy to share with you all, and you can hand it out to your group. And, if you can spend 10 to 15 minutes of back exercises, especially in the mornings, before you get out of bed, if you can see 2A, just bring your knee into your chest like this and count till 10, one knee at a time. Bring your knee into your chest and count till 10. Those will really, open up the lower back muscles, and any kind of aches or pains that you have when you get up in the morning. First thing in the morning, a lot of people feel stiff. Those will go away. It's very important that you follow, at least do 10 minutes of, some form of core strengthening exercises. You have to understand that you have to not only strengthen your back muscles, but also your abdominal muscles, because those are the muscles that really hold the the spine together, and that's key to good spine health. But when you mustn't neglect it, if you're elderly and you have back pain for the first time, if you have a fever associated with back pain, any weakness, any trauma, if you've had a trivial fall and you have back pain, then don't. Supposing you've had a history of malignancy, you've had breast cancer, you've had any other cancer, and you've been in remission, and then 10 years later you start having back pain, please do an MRI, because it could be a spread of the cancer, and you just say, oh, this is just mechanical back pain. So there are keys that you should remember when to consult someone, and when to be able to manage this on your own. And nowadays in the elderly, we are seeing a lot of infection. A lot of people who are on dialysis tend to get infections of the spine, and those can be treated in a minimally invasive fashion. But sometimes if it's a big infection like this, we may have to do a big operation. But nowadays surgery is also recommended only for a very, very small subset of patients. And the beauty is that now we do 80% of our operations in a minimally invasive fashion. And the advantage of doing something in a minimally invasive fashion is that you have less tissue damage, the pain is less, the blood loss is less. Patients go home, in elderly, those in their 60s, 70s, those are the people who have these problems. And they can go home the same day or the next day after surgery. And that's the beauty of adding technology to treatment. The only thing different in spinal cord tumors is while degenerative problems of the spine happen when you're standing, sitting, walking, spinal cord tumors, the pain is when you're lying down. So if you have pain in your back when you're lying down, that also is a sinister sign and should not be neglected. Similarly, if you have neck problems, this cervical spondylosis or slip disc of the neck, etc., those again are very common, and those happen to be so more common because of constantly staring at a computer screen. And the way to really prevent them is to do something called as isometric neck exercises. All of us are on the phone all the time, and staring at a phone like this in this angle is equivalent to carrying a 30 kg weight on your head. So the one thing to do is to do isometric neck exercises 2-3 times a day. Push your hand against your head and count till 10. Push your head back against your hand and count till 10. Push it sideways and count till 10, and the other way. That way you'll increase the tone of the spine, and it will really help substantially. But when you see a physician, if you have tenderness when you press, if you have restriction of neck movements, if pain is going into your arm and you have tingling and paresthesia, you should get it checked and not just ignore it and say that this is something that will pass. Like we said, we operate on very, very, very few patients who need surgery, and I only operate on patients who I think will be 95 to 100% better after surgery. So it's very important to choose a candidate, and most of these patients you can manage without an operation. The other really good and important thing to do is make sure your calcium and vitamin D3 levels are okay. If your calcium level, D3 levels are less than 50, then you should take some amount of vitamin D3. Everybody has, those various Uprise D3 or Depura, which comes in a small little bottle. Every once a week for a couple of months, you can take it to optimize the thing. And if you're above the age of 60, you should get a bone density scan to check for osteoporosis. Osteoporosis is quite common in our society. And if your bone density scan shows osteoporosis, then you may need some kind of injections, either daily or once in 6 months, to maintain bone health very, very adequately. So I'm not going to waste more time talking about it. The other myth is that, they say that, oh, if you have spine surgery, you're going to become paralyzed, or you're going to not get better, you're going to be in bed. And that, in fact, is a myth, because now the success rate of modern neurosurgery, modern spine surgery is more than 99%, with a complication rate of less than 1%. I'm happy to share my email address and cell phone number, etc. with you. There's a lot of information also available on the website. But what I'll do is I'm going to, this is just a gist and an overview of what entails in taking care of your spine. I was given 15 minutes, and I hope I've covered most of the important things in that. But if Mr. Maheshwari agrees, we can go ahead and take some questions.
Yeah. In fact, Doc, I must confess that your presentation has been excellent, and thank you for all of this. If you want to go ahead and give some more stuff, I'm happy to, give you more time, and then you can take some more time But
No, I'm good. I mean, I'll rather we
right, absolutely.
share. I mean, we can do a separate session on the brain and the problems associated with the brain in the elderly. Mainly headache, stroke, dizziness,
That's right.
forgetfulness, and those we can again cover in a separate session. But I think we'll focus and stick to spine mainly. And if there are any questions and people have the time, we can
Yeah,
address these questions. I
yeah.
can
So
see
some
that there are
questions.
2 questions.
Yeah, so I'll take those questions, and if you could just unstop the screen scare, and yeah, great. Uh, Thank you. There are quite a few questions that have come in. I have one question that has come in via mail, which is from Mr. Gurdeep Straw, who has been here with us in the past several times. His question is: I'm 65, male. I have a history of slip disc, once in 1981 and second time in 2009. In 2021, I was found to be suffering from cervical spondylitis with bony growth in C3, C4, and C5 region. As he said, he's 65. I had lived with back discomfort since 81, but since September 2020, have been largely relieved of the backache after I started simple core strengthening exercises of the back and the abdomen, initially under supervision of a physiotherapist for a fortnight, but subsequently on my own. But for the last few months, I have noted that I get a tingling sensation in my feet, especially in the morning when I go for a walk for an hour. I have found relief from it by sitting on my haunches for a count of 10 with 5 repeats. What is the reason and what can I do to improve my well-being? That's his question.
Yeah, so I mean, you've done quite a bit already. I mean, you've really exercised adequately, and you've come out of any kind of pain that was debilitating. The tingling in the feet can be because of several reasons. As you age, if you have diabetes, then that can affect the nerves a little bit. Any kind of other neuropathy, also just age-related neuropathy. If you're taking certain medications, that can affect it. So it might be worthwhile doing a blood checkup. Just a basic blood checkup, which includes a CBC, a liver function, kidney function test, to make sure all your parameters are okay. Make sure your sugars are strictly under control. And if it still persists despite all of that, then doing a nerve conduction test would really determine whether it's a neuropathy. And sometimes you may really not have an answer and not be able to do anything except for continue being mobile and continue walking, continue strengthening your core, and take it from there. But as a question of well-being is what I said. Don't sit in any one position for more than half an hour, 45 minutes. Take a brisk walk every day for about half an hour, 45 minutes. Keep as mobile as possible. Use the stairs, walk to the grocery store, walk to the bank, bicycle if you can, swim if you can. I mean, there's no real rocket science to this kind of an advice. It's very basic and simple advice, yet it's really hard to follow.
But Doc, some of the things that you mentioned, while exercise is one thing, is fine. The sleeping posture that you suggested, with the pillow in between your legs and etc. Now that's something which it's just perhaps too difficult to practice on a day-to-day basis, or is that something that you recommend for everyone who is above 50 or 60?
Yeah, actually, it's not difficult to practice at all. It's just a matter of forming a habit. You've been sleeping in one particular way for your whole life. Obviously, if someone asks you to do something differently, it's going to be a sore. But they say that if you can stick to a habit for about 21 days, it's highly likely that you will be able to pull through with it. So just try it out and see that the difference it makes in your aches and pains, because these are really positions designed to ergonomically balance out the spine.
Absolutely, and this presentation by Dr. Mazda Turel is going to be there captured on video, and it will be there on seniorstoday.in on Monday, so you can go ahead and look at that, take your screenshots, etc., and practice and try and do that every day. We have a few more questions that have come in. One is from Mr. Vijendra Kumar. He hasn't mentioned his age, but he says my back hurts and seems temporarily frozen after I get up from prolonged sitting of, say, about 45 minutes and more. It gets better after I move around a bit. What could be the reason?
Yeah, so it's basically muscle spasms. you're not really toning your muscles. So like I told you, if you do this exercise 2-3 times a day of putting your knee into your chest and counting till 10, you'll really stretch out those back muscles which go into spasm and cause pain. So try that, and that'll be a great relief for you to, you won't, every time you get up, you won't have that pain.
Doctor, this question about physiotherapists. Now, there are. What does one look for when you're looking at selecting a physiotherapist? Is there somebody whom one should, who's obviously trained? There are people who are, you have your masseurs, etc., also who are there who help around. So is there something specific that we should look for?
Yeah, I mean, a good physiotherapist is someone who will be able to identify your problem and work on certain muscles. Sometimes you have a specific group of muscles that are weak, and those need to be strengthened. So, going to either a spine clinic or having a good physiotherapist come home, and they'll be able to really understand whether this problem is mostly muscular or is it related to the bone, joint, nerves, ligaments, etc. And they'll be able to work with you to be able to strengthen those things. So, mainly it just requires core strengthening. That's about it.
Thank you. We have a question from Zareen Shroff, who asked, does coco joint collagen help?
Help where? Does it help in for the spine, to the knees?
For the back must be.
I'm not particularly familiar with this. I mean, I'm sure it's just a collagen drug that probably comes in a capsule, and a lot of these things are available in the market. I would rather that one focuses on strengthening the muscles, and that's the greatest thing that helps.
Great. We have a question from Mr. Sanjay Bhatia, who's 63. His question is: in winters, I develop a stiff neck and shoulder, and also hands. This happens when I get up with the passage of time. With the sun rising, it reduces. Like right now, I have a stiff hand, upper portion. Please advise suitably.
Yeah, so like I said, like how arthritis affects your knees and elbows, it affects the spine as well. And in winters, these things worsen. You must have noticed, anybody who has joint pain, all their pains worsen in the winters because of the temperature, because of how the joints contract a little and rub against them a little more. So the key is really in stretching your back out and in strengthening your muscles. I know this sounds repetitive and almost boring, but it's as simple as that. You do a set of basic back exercises, neck strengthening exercises for 10 minutes a day, and I'm sure that this will disappear.
Right. We have a question from Hema Nayak. It's not concerning a senior citizen, but I guess she is, which is spina bifida occulta defects at sacral S1, S3 for a 5-year boy. The doctor said not to worry very much. She hasn't asked the question, but I guess she.
I understand that the spina bifida is a congenital defect where the spine doesn't fuse, and in some patients, it's asymptomatic and you can leave it alone and you don't have to worry about it. And in some children, it causes a little bit of leg weakness and bowel and bladder dysfunction. So one really needs to examine the child, look at the MRI, and see what the extent of the cord gets a little tethered, and because of which you have these symptoms. But I'm guessing if the doctor has told them that it's okay and not to worry, the patient does not have any symptoms, and it must be the asymptomatic variety where you can leave them alone.
Doctor, I've got a question, which is, Dr. Mazda, what are the preventive checkups one should do after one has crossed the age of 60?
So, from a general body perspective, you should have a complete blood test done, and there are packages that are available at every lab, and which involve doing a CBC, a liver function, kidney function, vitamin D3 levels, vitamin B12 levels, thyroid levels. You should have a chest X-ray, ECG, 2D echo done, and at least a stress test. You should have one colonoscopy to rule out any kind of colon malignancies, and that usually is more than enough. And above the age of 60, some of these things should be done annually, some of these things should be done every few years. And for the spine, you should get a bone density scan to look for osteoporosis. And if there is osteoporosis, then you should be treated with, there are a couple of varieties of injections that can be given, or tablets, depending on the grade of osteoporosis. So those should be done. So that kind of a medical checkup should be done comprehensively if you're above the age of 60.
And how often is the bone density test that you advise?
So it again really depends on what the baseline value is. If the baseline value is normal, then you can do it every 5 years. If there is an abnormality, then you might want to do it, take the medication and check again after 2 years.
Right, thank you. We have a question from Mr. Ashok Panjwani, who says, my liver transplant was done 45 days back and I have to stay at home for 3 months. So I have to sit full day at home. But from the last few days, I'm having a back pain. I am 65 and his name is Ashok Panjwani from Nagpur.
Yeah, so I'm glad your liver transplant went off really well. Even if you're staying at home, my suggestion would be not to sit the whole day. My suggestion would be to be as mobile as possible. Every half an hour, get up from what you're doing and just take a walk around the house and then come back. If you're allowed to and able to do gentle back strengthening exercises like the ones that I showed you in the file, then you should try and do a little bit of those. Just, strengthening even your hamstring muscles and your quadriceps and your knees and all these muscles that usually get wasted by prolonged periods of lying down or sitting. Those should be continuously strengthened. So if you're allowed to do some mild kind of physiotherapy or exercise, then you should continue doing that, and don't sit for more than half an hour, 45 minutes at a time. Keep changing your position.
Yeah, doctor, the lady who asked about the 5-year-old boy says that after the MRI, her doctor said not to worry. So
I'm guessing it must be okay.
Yeah. So we have it's not a question actually, but perhaps you could add something to it. This is from Jamila Mulki, who's 65. She says, I was told the same exercises for my back pain. Now I'm okay. I have to continue. Have I to continue the exercises? I was told to walk for 30 minutes by the orthopedic doctor.
That's good advice. And exercises is not someone only for back pain. Exercises is for something that you should do for life. There's no substitute for that.
Right, thank you. We have a question from Mr. Brish Duggal, who's 78. He says, I have a back problem for the last 10 years. I do yoga and sadhana, which involves sitting across legs for 30 minutes. I also do Surya Namaskar. It gives me relief, but pain continues. Is it okay to continue in this manner?
Yeah, I would suggest that you continue your yoga and sadhana and your Surya Namaskar, but also add to it, add to the routine some kind of core strengthening exercises that strengthen the muscles of your abdomen and your spine, so that you don't get too much of back pain.
Thank you. We have a question from Mr. Malcolm Montero. He's 68. He says his vitamin D3 levels are 40. Does he still need to do bone density tests?
Yeah, the vitamin D3 levels are good, but that is exclusive of the bone density. Having a high vitamin D3, you may still have osteoporosis. So you should do a bone density scan and check.
Yeah. Doctor, this person who had asked about the liver transplant, he has asked another question. What exercises do you suggest he does?
We can send you a chart of back exercises and you can follow those.
Yeah. Mr. Panjwani, my request is if you can just send me your email address at editor@seniorstoday.in, and we'll request Dr. Mazda Turel for the chart, and we will forward it to you.
I'll WhatsApp it to you right now as we speak.
Great. So yeah, he has sent me his number. I will just request my producer to do, and I have also copied it right now. Yes, Mr. Panjwani, I have got your number as well. So I will send it to you the moment we finish with the show. Great. Thank you, doctor. And we have a question from Kali Murthy, who says, 20 years back, my penile card got small damage but still I get some pain, if any. Is there any remedy for me? Doctor, you are on mute.
I'm guessing he's saying pineal gland,
Finally, yeah, perhaps.
which is, but that has nothing to do with back pain. Uh, I'm unable to understand the problem completely. If he can either shoot me a message or an email, I'll be able to, if he has some reports of what exactly happened, we'll be able to address his issue a little better.
Right. Doctor, there's a remark from Zareen Shroff who says, thanks, I do these exercises and they do help a lot. Also, sleeping with a small pillow between the knees helps a lot.
Yeah, exactly. See, that's what I told you.
Yeah. Doctor, I've got a question from somebody about how often should one change the neck pillow uh, for to ensure that there's no neck pain?
I mean, there's no hard and fast rule. You sometimes get these cervical pillows that contour to the curvature of the neck, and you can use those. Changing them once every 2 years should be a decent time frame, I'm guessing.
And is there any specific kind of pillow that you would recommend?
Yeah, you get cervical pillows. They're called cervical pillows.
Because there are huge amount of ads that are there in the newspapers, on the websites, etc. So one needs to look at which are the best ones to buy.
I mean, there's really whatever is comfortable for you is actually the best for you.
Great. Yeah, Mr. Rantanan, we will forward we will try and forward it to you. I think when you registered for this session, you would have put your number. We will take it from there and try and forward it to you. In any case, what we'll do is we'll have all these exercises which Dr. Mazda spoke about and in his presentation will be part of the edited video that will be there on seniorstoday.in on Monday. So please come back to that and look at it. Dr. Mazda, this question which has come in from an anonymous attendee is that I'm unable to exercise every day because of the fact that there are various restrictions that exist. I'm not able to go for a walk because it's exceedingly cold. I am in Delhi. Is there something that I can do to do things indoor beyond what the exercises that you have recommended?
Maybe climbing stairs would be a good option. If climbing stairs, and if you can get a stationary bicycle at home, then that's also a good option. Climbing stairs is a good option, and doing these exercises is a good option. If you can get into some kind of yoga, if you have a treadmill at home, then that works. Cross trainer is a really good option, depending on what the logistics are for making these things available at home. But just as simple as climbing stairs will also make a big difference.
Right. There's a question which has come in, which is, kindly clarify what minimally invasive surgery entails as compared to a full-fledged surgery.
So minimally invasive surgery is a concept wherein which what it's a very targeted concept. You don't open up the skin through the midline. You don't dissect all the muscles and remove all the bone like we used to once upon a time. It's a very focused approach. The skin is the only thing we cut. We don't even cut muscle. The muscles are dilated gently with a tube, and we decompress the nerves with specific instruments. And the corridor that we use is very narrow, but it still achieves the kind of relief of pain and decompression of the nerves like a big full-fledged surgery would. This is because we have the advancement of technology and tools and specific instruments to be able to do now the same thing in a slightly modified fashion. So that way the recovery is much faster, the pain is less, the tissue damage is less, the infection is less, and patients can go home the next day after surgery.
Great. Thank you, Dr. Turel, for a fantastic session. I think you answered most of the questions that have come in. There's that person who's suggested something about or said that he gets cramps on his calves very often.
That may be a sign of lumbar canal stenosis, and one might want to evaluate whether doing an MRI might be worthwhile. The other option is, sometimes vitamin E deficiency can cause this symptom, and taking a tablet called as Evion LC, which is a vitamin E supplement, might help.
Right. We have one last question that has come in, which is, I have a severe neck pain for many years, about 6. I take one Lyrica 75 every day, which takes care of the pain. Is a prolonged use of Lyrica okay?
Yeah.
76.
It's okay. It's not a problem as long as it's not causing you any side effects. It doesn't really have much of a issue on the kidney or the liver. If you want to give a try, you can see if instead of taking it every day, taking it every alternate day also has the same effect on the pain. And if you're still pain free by taking it every alternate day, you can stick to that and then maybe reduce it to twice a week. You'll be able to figure out what works for you. But taking it long term is okay.
Right. We have come to the last of the questions right now, Dr. Mazda. Thank you very much for this session. I think it was exceedingly enlightening, informative, and as I mentioned earlier, the presentation and this video and the question and the responses to the various questions that have been asked here will be there on our website on Monday morning. So you could refer to that and get all the details. Dr. Mazda Turel's email address and phone number, which he has shared with us, is also there. So in case you all have any questions to him directly, you could send him the question directly. And I'm sure he is also available for a teleconsult. And in case you need to have consult him, you could also send him your reports, etc., and take it from there. Thank you very much, Dr. Mazda Turel, for this session, and appreciate the time that you've taken to answer all the questions.
It was my pleasure entirely. I hope it helped some people a little bit at least. And I'll be happy to be back on your program and to discuss some brain issues the next time.
Absolutely.